So Memorial Hospital, like Kate said, is in southern Indiana in the city of Jasper. Jasper is located in Du Bois County, and Memorial has 33 clinics in 8 different counties. Those 8 counties are Pike, Davies, Martin, Orange, Crawford, Perry, Spencer, and of course, Du Bois. And not only are there primary care clinics, but we also have specialty clinics that include cardiology, pulmonology, neurology, urology, and pediatrics. And 2 of our clinics in that area are designated as rural health clinics. One of those clinics is in Martin County, and the other is in Davies County. And several of our clinics do not have any RNs working in them. You will find LPNs and CMAs. In the last year, Memorial has employed 1 social worker for all of the primary care clinics. And the clinical leadership is limited by the directors and managers covering multiple clinics. This does prohibit their presence in each clinic daily. There is also a limited professional development, preventing staff from attending conferences and furthering their education. This is a picture of the clinics that have been part of the HRSA grant in several different counties.
Okay, just a little bit about the state of primary care in the United States again. So primary care, and all of us who are working within the primary care system know that it really is in need of some transformation. The existing organization of our country's primary care organizations are inadequate really to meet the healthcare needs of our nations. You know, we see a growing gap of our primary care, our family practitioners that are retiring and certainly aren't keeping up with the licensed family care practitioners that are actually coming in to the primary care organizations to really meet the healthcare need of our patients. We also know that the Affordable Care Act has helped people get insurance. Over 2 million people were insured through the Affordable Care Act, which is really all about preventative care. It's allowed people to get insurance. These are the people that were presenting to the emergency rooms that are now presenting to our primary care clinics. Those are the patients that need our preventative health care or their health care restored. And so that's one of the reasons why we did our project. Another thing you all know, we're all nurses here, we know that chronic disease is rising. Certainly it's expected to exacerbate even over the next several decades. Today, approximately 6 out of 10 people will have at least one chronic disease. And along with those increasing rate of patients with chronic disease presenting, we also indicated by this year, 2022, there will be 113 million people that will be considered clinically obese. So we have a lot of factors going on in the primary care clinics that are patients that are presenting to us nurses that need some help. So that's what we're trying to do with our project here. We also know that resources allocated to primary care are inadequate. Healthcare is currently in the middle of a transition. We're going from fee-for-service system to a value-based system where our clinics are being rewarded for the good quality of care, and that is a good thing. Lower cost and preventative care. So those are some of the good things that are happening right now, are trying to happen in the primary care. We also know that team-based care models versus that physician-centric model are really the idea That's that transformation, as Dr. Malone said, that we're trying to work toward, that will also be very prominent, hopefully, in our primary care clinics. You know, one of the beautiful things about team-based care is it's not just the provider, the licensed provider. It's that CMA, it's that CCMA, it's that LPN and the RN, all working to the scope of either their certification or the top of their license, working together to bring along that patient into helping them restore their health or prevent any other health problems. So again, it's working collaboratively, everyone together in that clinic to help that patient. So that's where we become the RNs in primary care. So why RNs in primary care? Well, basically, there's over 4.2 million registered nurses in the United States. That's the last that I checked. There might be a few less now since COVID, but again, there's many registered nurses in the United States. Right now, because registered nurses haven't always been in the clinics, just because they cost. They cost. And they've been underutilized, of course. You know, we've had, as the CMAs have come in, providers have sometimes even replaced RNs with the CMAs. And we all know, as registered nurses, we have the capability of assessment and all those important skills that we bring to our primary care clinics that our patients are in need of. So again, those are just some of the reasons why the current state of RNs in primary care now. Mostly nurses, RNs have focused on triaging, but now we have nurses doing a thing called flip visits, where they actually share the patient visit with the licensed provider, bringing in revenue. Again, that's a new thing that's going on. We have not tried that yet, but that is something that we see in the future. But again, RN work in primary care clinics really has been looked upon by administrators of organizations as an expense and not as the gift that the RNs can bring to the primary care. RNs seldom are working to the top of their license in some of the primary care clinics. When we first began this project, we did a Gemba walk in 2 of our clinics. And for those of you who aren't familiar with Gemba walks, it's part of the lean philosophy, okay? So a Gemba walk is when myself and my director actually went to the clinic and we talked to all of the staff and we looked at their work processes. What are you doing now? Why are you doing that? And how long does it take you to do that? And what we did find out is that in some cases, the CMAs, the LPNs, and RNs were all functioning as the same. There was no differentiation in accord to their scope of practice. One example was we had one registered nurse that came to us and said, I can't possibly think of doing an RN-led visits because my provider wants me to call reminders to his patients for colonoscopies. These were just reminders that she had to do, which took out so much time. And again, that could be something that could be delegated to a CMA to do that because that's within their scope. But an RN could do much more. So again, those are some of the things that we saw during that Gemba walk as we started out with this project. And again, education, as I said before, has really been more focused on acute care and inpatient care. So again, that was something that we wanted to kind of reverse on that and bring more of the experience into primary care. And of course, unlike the acute care settings, very few primary care organizations now have kind of a robust RN orientation. You know, bringing a new RN into a primary care clinic. How are you orientating that RN? What kind of a orientation? What are you including in that orientation? Or is it an orientation where you include all in? So again, just some things to think about that we were thinking about. And I wanted to share this with you because this basically was a great motivator for us. as we brought RNs into the primary care. In June of 2016, there was a conference of Macy Foundation sponsored, and that was Registered Nurses, Partners in Transforming Care. And again, the major value to enhancing contributions to RNs practicing in primary care was really the basis. This was a collaborative effort on part of the American Academy of Nursing and also the Hosea Macy Foundation. And I wanted to include this whole conference really focused on the RN. It focused on primary care and some of the issues I spoke about earlier, but it focused on what can that RN bring to primary care.